My name is Dr. Sudha Swaminathan. Your kidney doctor has requested a kidney biopsy for you to help better manage your condition. Kidney biopsies are done at the Day Medical Procedures Unit, which is located on the ground floor, just next to the revolving doors at the eastern entrance. A nurse from the unit will contact you via telephone a week before your biopsy. They will go through a questionnaire with you. They will also answer all your questions about your pre and post biopsy care. On the morning of your biopsy, please inform the receptionist at the Day Medical Procedure Unit on your arrival.
Hello, I am Carrie. I will process your admission at the Day Medical Unit. You will then be taken inside our observation bay by one of our nurses. You will often be asked to have a blood test done at Path West Pathology, located on the same floor. If your specialist has provided you with a pathology form, you can get the test done 1 to 2 days prior to the procedure, which will allow you to get your biopsy completed more quickly on the day.
Hello, I'm Nadia. I or one of my colleagues will meet you and get you prepared for the procedure. We'll help you change into a hospital gown and collect a urine sample. Although you may have already done one at the laboratory, this will remain as a baseline, so compare this with the samples after the biopsy. We'll put a cannula or a drip into your arm as a precaution. If you have fistula in your arm, let us know. In a short while, your doctor will come in to make sure you're ready to proceed with the procedure. He or she will explain the procedure and any risks to you and get your consent to go ahead. If you're on any blood thinning medications or fish oils, make sure you let the doctor or the nurses know. Usually, you'll have been instructed to omit these prior to the biopsy. Fiona Stanley is a teaching hospital, so you may find trainee doctors or nurses watching what we do and learning. When ready, we'll be taking you into the procedure room.
Hello, my name is Harish, and this is Joel. He's having a kidney biopsy done today. In a short while, Joel will lay down on his tummy and will look at his kidneys with the ultrasound machine. If you are having a biopsy of your transplanted kidney, you'll be laying on your back. Once we mark the spot, with the help of the ultrasound, we'll clean the area and inject the local anesthetic. This usually stings for a few seconds. Following that, we will proceed with the biopsy using the biopsy needle. The biopsy needle can make a loud clicking noise, like a stapler. Hold it, click. And we usually need to take 2 or 3 samples. The lab scientist will also be in the room to check the sample under the microscope and ensure that we have adequate sample for all our tests.
After biopsy, you'll go back to observation bay and have to lie flat on your back for 4 hours if having a transplant biopsy or 6 for a native biopsy. We'll keep a close eye on your blood pressure and check your urine to make sure everything is going okay.
The kidney biopsy is generally a very safe procedure. Most people go home the same day after a period of observation. Complications are rare and occur in less than 5% of people. Sometimes the kidney may continue to bleed from the biopsy side, either around the kidney or more commonly in the urine. If this occurs, we may need to admit you to the hospital. In most patients, this will stop without any further treatment. Heavy blood loss, including bleeding around the kidney or passing blood clots in the urine, happens to less than 1 in 100 biopsies. Blood transfusion may be needed in about 1 in 50 because of blood loss. On rare occasions, another procedure may be needed to stop the bleeding. Very, very rarely, we may need to remove the kidney to stop the bleeding if it is life-threatening. The risk for that is very low and less than 1 in 1,000 biopsies. Bleeding can occur even after you go home, so if you notice worsening pain or blood in your urine, contact the renal transplant nurse or the renal on-call at Fiona Stanley for advice. If you're feeling faint or in severe pain or any other concerning symptoms, call an ambulance or present to the nearest emergency department immediately.
The results of the biopsy are usually available within a week. If you do not know when your next clinic appointment with your doctor is, please ask one of the staff on the day to confirm.
Oh, and after the procedure, please give us your feedback about your experience with us on the Fiona Stanley Hospital website. We love to hear from you. We always strive to make your experience with us a comfortable and safe one. Thank you.